So you have issues with movement and posture, and the question is, where do I start? What body part do I start? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Irvine Spine and Wellness Center, and the subject is exactly what this video is all about. When you have an issue with functional movement, when you have issues with postural presentation, which has nothing to do with aesthetics, it has everything to do with functionality, then the question is, where do I start? Do I start with the pelvis, or do I start with the top because I'm hunched over? It's really difficult when it comes to correction. I always look at it like Thanksgiving meal. You don't cook the turkey all the way, or whatever it is. If you don't eat meat, you get the point. You don't make the main part of the meal all the way and then start attending to each side all the way and then go back and forth. You've got to start working on every aspect of it. But where do we start? If we go by what logic dictates, we start with the base and we go up. But so that means lower back and pelvis. So I want to make sure you're very clear here, because when I say we start with that, that does not mean that the pelvis is more important than the top, because the top, or lack of performance of the top portion of your body and upper extremities as an example, will immediately transfer into extra load and dysfunction in the lower back and pelvis. So it's not even 50-50. If it's not, it's more like 51-49. So to start, I always introduce the concept of leveling of the pelvis, and then introduce the breathing, which involves the thoracic diaphragm and pelvic diaphragm. So immediately, as soon as I start bringing that concept into the understanding of the patient, then we start moving to introduce the top half into the picture. Just wanted to throw that in for you, for those of you who are do-it-yourselfers, and this should help you some. If you like what you saw and you'd like to get notified about future videos, subscribe to the channel and contact me using one of the methods of contact in the description box. You can also follow us on Instagram, which the handle is Irvine Spine. Thanks for watching. Until next time, take care.